So I think the new plan is very welcomed. It does give us a light at the end of the tunnel that over the next sort of 5, 10, 15 years, we will hopefully have the amount of staff in the NHS, both medical, nursing, allied health professionals, that we really need to be able to provide the care that we would all want to provide for our population. So I think it is hugely welcomed. But I think it is really important that we recognise that this is a long-term fix and it doesn't solve the problems that we have here and now in the present time, where we have a huge demand on the NHS, both from the backlog and from emergency care. And we have a staff who have been through a lot over the last 3-4 years, and they are stretched. We recognise that, our staff are putting in a huge amount of effort, and being able to value our staff, to being able to retain them, to be able to offer over and above what we can just purely in financial terms is critical if we want to retain these staff within the trust.
Yeah, how do you retain them? I mean, some of the things that are mentioned in this plan, better flexible working, better career development, better health and well-being, and pension scheme reform as well. And there was something mentioned as well about recently retired consultant doctors offering their availability to trusts. Will that help?
So I think all of these factors help in terms of trying to retain some of our most valued colleagues and staff who work in the organisations. Some of those are national initiatives, but there are a number of local initiatives, and you mentioned yourselves, around how we attract some doctors and nursings through the fellowship programmes, and as well as providing high quality training for them. What is critical is that we provide that pastoral element. It's around supporting them if they're coming to a new country. It's about the aspects of life outside of work, social, financial, cultural aspects, faith aspects that are really important. So staff feel valued. It's really simple. We need to value our staff. We need to make them feel as a valuable members of the community, members of the organisation. And with that, hopefully we will retain as many staff as possible. But we do recognise that this is a very sort of difficult time. There are a number of vacancies in the NHS, and people have got offers in a whole range of different professions. So we need to work extra hard for people to come and work within the NHS. And people don't come to the NHS to make lots of money. They come here to look after patients. They come here to care for our populations, and we need to give them that time, support to be able to allow them to do that, because if we do that, it becomes a very rewarding profession to work in.
And can you truly fix NHS England without having a similar social care plan in place?
So I think we've seen over the last few years how critical that partnership working with our social care partners and colleagues is. It absolutely has to be part and parcel of how we fix the NHS, if we ever can fix the NHS. But to be able to make sure that our patients and population get the right care in the right place, that has to be a combined effort between what we do within acute health care, but also what happens in primary care, community care and in social care. All of these aspects are so interdependent, it's critical to get it right.
And you were quite candid to me earlier, saying that you felt morale was challenging. What are the pressures inside at the moment on your hospital? Because I know your vacancy rates are low, but you'll be struggling like all hospitals, won't you, with waiting times, whether it be for ambulances or care?
Yeah, so I mean, across the whole NHS, everybody is very acutely aware of the backlog of patients that we absolutely want to treat. We don't want anybody waiting longer for treatment than they would expect to. We don't want anybody coming to harm for having to wait too long. And that creates pressure because, as health professionals, we want to provide that care in a timely way. And having those backlogs creates an innate pressure within us, as well as the pressure of reaching certain targets. We all want to meet those targets so that patients get treated in a timely way, but that does cause pressure on staff who are already in a very sort of stretched position. And similarly, in urgent and emergency care, we've had to make significant investments so that the quality of care and the timeliness of that care that we provide, it meets the expectations of the people who are coming to this hospital, so that we can get ambulances back on the road in time. And we have to recognise that we do need those additional staff and those additional investments if we want to provide that quality of care.